Hey besties, welcome again to Referral Unfiltered. And now this is the part 2 of our lesson on abortion, right? And so if you have not checked out the previous videos, click here and go watch it, or go through my page, my videos, and watch it so that you have better clarity for this one, right? So we are going to continue with the conversation about what abortion is, and also is having an abortion that bad, and all the nooks and crannies of having an abortion. Okay, so now I'm going to want to talk about the emotional stage during an unwanted pregnancy, when somebody is pregnant and they are certain or not sure whether they want to continue and want to end it. Okay, and also we are going to talk about comprehensive abortion care, and that's the pre and post cancer, and the procedures for ending a pregnancy, that is in the case of safe abortion. All right. And so these are some emotional states or trauma or women go through when they have a pregnancy that is unplanned, unwanted. All right. Again, this is a judgment-free zone, right? And I know issue of abortion is quite sensitive and has a lot of moral ring to it, but empathize with me. So one, sadness. Probably the circumstances surrounding the pregnancy brings overwhelming sadness. Confusion. What do I do? Especially in the case you are schooling. Do I give up school? The baby, what will my parents say? Especially for young people. And uncertainty, or being unsure. Like, is this for me? And especially people that have to struggle in terms of the moral base. Is it against my faith? Am I sinful? Or is it against, have I sinned or not? Against my religion, right? And guilt. There's a lot of guilt, like, and especially when you are contemplating, this is a life. Do I end it? Am I ending another life? A lot of guilt that comes to it. Or in a situation of rape, why did I go there? If I didn't go there, this will happen. A lot of trauma. Then worry about the impact of the abortion. People have questions like, if I do this, what if this is my only kid? Will I get pregnant again? What will be the issues? Will I survive it? And all that stress, all these mental rage just brings a lot of stress, right? You get it? Then even some women who are married are afraid when their husbands find out, especially when the man says that, no, I don't want to have any kids again. But uncle, you didn't want to have any children again. Say you didn't know condom me. Well, but some again, contraceptives can fail. But as a husband, you need to be supportive, right? You need to have a discourse. What's your decision, whether to continue or if you end the pregnancy? Be supportive. Don't make it like it's only the man that do the thing now. Both of you did the thing together. Now you want to do like, oh, it's not my case, not my case. It's your case, uncle, it's your case. Yeah. Then also the stress to be left by the boyfriend who refuses to be responsible. Some aunties out there, oh yeah, I'm afraid, like, if the boy finds out, he will leave me. You deserve better slap. No, you're not violent. You're not violent in this our channel. But if he did it, and men, be responsible. If you did it, take it, test it with your full chest. Whatever decision you decide to make, don't leave her alone, right? This is serious. Okay, so let's continue. Now, if this is for my friends, sisters, and bros out there, that nonsense bro code must end. If your male friend comes to you that, okay, my girlfriend is in this situation, in offering your bro code advice, please offer referral, that is, if they have made their decision to end the pregnancy, refer for safe abortion. And this is where, as a bro or as a sis, you can help, right? So if one, for some stubborn reason, the person used dubious means and there's bleeding, please, you need to refer to the hospital immediately, right? In a case of rape, this is where the bro code doesn't work. Your friend has raped someone and you are keeping quiet about it. Shame on you. Shame. Please refer, right? And also, if the woman doesn't like it, I always say that women autonomy, like this is a rights-based channel. If after all this she's certain that most of the time, if people have made up their mind and are saying they don't want the pregnancy, you trying to use other means will only push them to opt for unsafe means, and that is not our prayer or wish. Do you get it? In the case of incest, or the person is confused, okay, the person finds out they are pregnant, they have not decided yet, and so refer her when they are in state of confusion, you don't know, or even you with the partner, both of you don't know. Please visit a registered clinic or a certified Ghana Health Service clinic to have all your questions and resolved. So refer. Don't turn yourself into a gynecologist or midwife. Refer, right? Refer for me. I'm enjoying the conversation so far. Trust you are doing it. Now let's talk about the procedures for a safe abortion service. So there are two main routes of procedures that are being done. We have the medical abortion and surgical abortion, right? So let's take medical. Medical is when we use medications, right, to end the pregnancy, okay? And it still has to follow the protocol I mentioned in the part one. That is, the medication should be given by a trained or a provider in a registered facility and whatnot. It's not my place to tell you what medication there. And those who have been abusing the medication, I see you. Please go. And remember that the type of procedure depends on the duration or gestation of the pregnancy. So if you don't go and they don't do the scan to know how old the pregnancy is, which procedure would you know? Don't let that boy go and buy things you don't know and be popping. Please, your life is precious. Stop giving things or taking things you don't know. Go to the hospital. That will be done for you. All right? Very, very important. And those medications are only provided with prescription. So the pharmaceutical people, the pharmacy people, over-the-counter people that just be doing anyhow, you know what I'm talking about. Okay, now to the surgical procedure. It is done using a manual vacuum aspirator. In some places, they use the electric vacuum aspirator, right? And this is a surgical procedure that needs to be done with all the protocols I mentioned earlier, right? So the vacuum aspirator is just the instrument that is used. I would put some pictures for you to see how it looks like. You get it? It is not a lengthy procedure. I've had the privilege of being in a couple that is during my internship days, and it is basically going to be under some local anesthesia. There will be pain management and all that. And so if you get to the facility, the midwife or the gynecologist will explain the procedure to you, right? So that you go, what it entails and everything like that. I recommend that, you go with an emotional support. I'll not say partner, go with an emotional support, because I know it can be a lot, but trust me, it is safe, it is fast. You don't even need any hospitalization. The same day you are out of the hospital, and recovery is smooth, and they manage for any other minimal complications, and because you're in a facility, you're able to better manage if anything, because all surgeries or all surgical procedures have a certain level of risk to it. But this is just to encourage you to opt for a safe abortion, right? Yeah, so that is for the surgical procedure for a safe abortion. All right, so now let's move to comprehensive abortion care. Now, this is the standard form of abortion services that is provided in most of our facilities, right? Ghana Health Service and other registered private facilities that are licensed to carry out abortion services. Now, when we say comprehensive abortion care, it is a procedure that is done for a woman who wants to terminate or end the pregnancy by giving her counseling on a contraceptive of her choice and post-counseling, right? So an abortion care or service is not complete when there is no counseling on contraceptives. It is not any joy of any health provider or even you as a to every day come with or for them to be doing an abortion procedure for you. Do you get it? And so one sure way so that it is not repetitive or is that is for you to have some form of contraceptive. So they're going to counsel you and opt for any of them that you wish to do. So that is what CAC or comprehensive abortion services is. Okay, so now let's go into the first part of comprehensive abortion services, that is the pre-counseling, right? So the pre-counseling, the first thing is to ask the woman or the client how old the pregnancy is, and most of the time it is determined when you ask the woman for her last menstrual date. I mean, when last you have your menstruation, they have a way of calculating. If the woman can't remember and is unsure, then an abdominal scan is recommended to note how old the pregnancy is, because like I said, knowing the exact gestation of the pregnancy would help to know which procedure to opt for. Then the next thing is for the whoever is doing the counseling to let the woman know where they can access the abortion services and the cost. Do you get it involved? So yes, there are some clinics you go, they can do the first line counseling, but they are not licensed to do the procedure, or there's no trained personnel to do that. So they'll refer you to a clinic that can do it for you. And yes, it's not free. There are some, but I know there are some NGOs that have clinics that have subsidized their amount, or depending on the circumstances surrounding the termination, it can be waived off. But most of the time, the procedure is not for free. And to my best of knowledge, the price is not standardized. So every clinic and the cost involved. So this is the first line for pre-counseling. So moving on, before the midwife or gynecologist starts with the procedure, these are some few questions that she may ask you, and to get information about the pregnancy, like what is your reason? You can't just walk in and say, oh, then midwife, I want to end the pregnancy, and they quickly do it for you. Why? Because sometimes it must be as a result of rape, and we know that rape is a crime in Ghana, and so if there have to be some prosecution, we also explore that part. If it's incest, there are also channels to handle that case. So we need to explore what are your reasons, how old is the pregnancy. Then they do the examination to certify that. Then also it is in the domain of the provider to explain to you all the options, right? Or emphasize on all the options that are available to you. So like I said, There are some people that generally they come, they want to terminate, but they leave the clinic and they've changed. There are other options, and so maybe yes, after counseling or because I came on show, someone will decide, okay, I'm going to give birth and have the baby, give up the baby for adoption. Some end up want to keep the baby and all that. But if the person after the counseling still remains to end the pregnancy, then it is done for it. So these are some of the questions. Then also, if you after the process, you are still hinged on ending the pregnancy, and all the methods and the procedures will be explained to you for you to understand, depending on how old the pregnancy, whether it's a medical procedure or the surgical one using an MV, manual vacuum aspiration. Sorry. Then also they'll discuss pain relieving method, the duration, and importantly, there'll be counseling on family planning for you. And I've encountered situations where the young people come, or even individuals come, because they are desperate. So they'll do it after the procedure is done. They do not go for the contraceptive, and in a few weeks they come back with another unwanted pregnancy. Yes, with another unwanted pregnancy. And so also you'll be given some form of antibiotics to manage the risk of infection. So yes, that is done. So the family planning bit and the pain medication and antibiotics, those are post counseling measures that are done for you. And yeah, so the more the procedures come with some level of discomfort, there's bleeding, slight abdominal pain, but all can be managed with some medications and support like that. So kitty bums, hey besties, I'm presuming that you've learned a lot from our sessions on abortion, and especially how to opt for safe abortion. Remember that whatever situation you find yourself, that is not the end of it. Nothing should push you to even think about ending your life or in general, or even listening to people give you false information and things to do that will compromise your life. Do you understand? So if this message is for people, if you ever find yourself pregnant and confused, whether you wish to terminate or keep it, kindly visit a facility to explore your options. Thank you so much, and I hope you've learned something. What will make me happy, don't keep this information on. Share it. Share the link. All right. So I come your way in the next video. It's bye-bye from me. Mwah.